All right, welcome back to Friends at 5. She is a name we spoke every day here on News 19 during the pandemic, Dr. Linda Bell. So excited to have you with us, formerly of DHEC, now the Department of Health. Yes. Thanks so much for being with us on this 5-year anniversary of the pandemic.
Thank you for having me again.
Can you believe that we're 5 months, or 5 years, I should say?
In some ways, hard to believe, yes, but in other ways, it's like we're still living through some aspects of that, unfortunately.
And we were talking a lot. We were picking her brain, y'all, in the commercial break, asking her so many questions. But how do you feel as a public health educator for our state things have gotten better since the pandemic?
Well, things have gotten better because our disease rates have declined. So that's a real positive, but we can't forget that we're still seeing cases of COVID, unfortunately. There are, a few hundred people die in the United States every day still from COVID. Wow. We're still seeing hospitalizations, we're still seeing complications, and these are preventable. So we've made advances because we continue to develop vaccines that are well matched to the currently circulating versions of the COVID virus, but we need to get more people to accept the benefits of that vaccine.
I'm curious too, as we hit spring and summer, is that the time when you can let your guard down, or should we still stay alert to possibly catching COVID?
We should still stay alert because unlike the flu virus that we know we have a flu season typically transmits in the winter at higher levels, but what we learned from COVID is that we saw year-round circulation. So especially for people who are at increased risk of complications, if they have underlying health problems or something like that, or if it's been the correct period of time since your last dose of the COVID vaccine, regardless of the time of year, you should go ahead and get vaccinated.
And speaking of the vaccine now, since you just brought that up, when this first came about, we got our first dose. There was the first dose, the second dose. Explain to people how that's changed now, but you still need to be updating your vaccine.
Right, and the reason for that, those recommendations for updates is because the virus continues to mutate. So people probably remember when we first saw the emergence of the Delta strain.
Yes.
And then we saw the emergence of the Omicron strain. And we continue to see small mutations in the COVID, in the virus that causes COVID. And so they continue to develop vaccines that are well matched to protect against the current circulating strain. So if it's been a while since you got a dose, you may have received the dose that protects against an earlier strain and that doesn't offer optimum protection against the currently circulating strain.
But that being said, how do you then address vaccine hesitancy, folks who are scared about the impacts? But you said during the break, the pros can outweigh the cons.
That's true. I find that I get so many questions about the potential complications from the vaccine. Some of them, there are rare complications of any vaccine, of any medicine, but a lot of what I get asked about is actually misinformation and things that are not accurate about the vaccines. People don't ask me enough questions about the complications of the disease itself. So people have forgotten that this is an illness, that virus that can affect almost any organ system of the body. It causes hospitalizations, preventable hospitalizations, and causes deaths. So the likelihood of a complication from the virus itself is far, far, far more common than any of the rare adverse events caused by the vaccine. So we're not hearing reports of complications from the vaccine, but we're still seeing, as I said, deaths, hospitalizations, long COVID and other illnesses associated with the disease, but not the vaccine.
Because you just brought up the deaths, it was incredible to me as we were researching, the 5-year anniversary that more than 1 million Americans died from COVID. How has things changed now, Dr. Bell, that we won't hopefully see that type of number again? What do we know in medicine now that we won't see a season again where 1 million people die from COVID?
Well, from COVID, from the particular strain, we think that the mutations in the virus that causes COVID have sort of slowed from the time that they were progressing rapidly. And one of the things that leads to those more frequent mutations is the virus's ability to infect a lot of people and then change when it finds warm bodies. So the fact that we've slowed that down a little bit decreases the likelihood of mutations, but we still may see those. Now, we are so hopeful that we will not see these changes in COVID again, but there can be other novel viruses, and from a public health perspective, we continue to do surveillance for other novel viruses, because we had COVID. We don't know that the next thing that may hit us could again cause a pandemic from a different cause, from another novel agent that can make far too many people sick.
Real quick, I do want to ask, as a toddler parent, what you said to us during the break about behavioral changes that you noticed with certain age groups. Can you talk about that?
Well, that might be one of the complications that we see with long COVID, because the manifestations of long COVID can be varied. If it infects your lung system, people may have trouble recovering to their baseline. They may have prolonged periods of shortness of breath. If it affects their heart, then they may continue to have heart problems. Well, if it affects the central nervous system, then we can see problems with clouded thinking. But in youth, we've actually seen some behavioral problems. So young people who have just a behavior change that may manifest differently, and that's a concern because it affects their learning, it affects their normal abilities. And so the concerning thing about the virus is that it's unpredictable in where it can affect your body, and it's unpredictable who might suffer those complications. So we often talk about people who have underlying health problems who are at increased risk of complications, but we also see far too many people who were previously healthy, no previous problems, who suffered from complications from COVID.
All right. Unfortunately, we are out of time, but your advice again today to the general public, keep up with your COVID vaccinations.
Yes, yes.
All right, Dr. Linda Bell, thank you so much for your time today.
Thank you.